Every moment, someone loses their life to a heart condition they didn't even know they had. The signs were there, but ignored. That's why heart disease is called the silent killer, the leading cause of death worldwide. According to the CDC, over 600,000 people die from heart problems every year in the US alone. In this video, you'll learn to recognize the signs of heart problems before it's too late and learn how to protect your heart. Stay with me till the end, because it could save your life or someone you love. Let's start. Remember, recognizing them early can help prevent more severe complications like a heart attack, stroke, or sudden cardiac arrest. If you or someone you know experienced any of these symptoms, it's crucial to seek medical attention promptly. 1. Chest pain, angina. This one's a biggie. If you ever feel pain, tightness, or pressure in your chest, kind of like something heavy is sitting on you, it could mean your heart isn't getting enough blood. Think about it. Your heart works hard every second, and if those blood vessels are blocked, it struggles. That's when you might feel that squeezing or pressing sensation. It's not always sharp pain, so even if it's mild, don't brush it off. This discomfort often shows up during exercise, stress, or heavy meals, when the heart's oxygen demand increases. It is a major warning sign of coronary artery disease or an impending heart attack. 2. Shortness of breath. Ever feel out of breath doing something simple, like climbing a few stairs or even just sitting down? That's not normal. This could mean your heart isn't pumping blood like it should. When that happens, fluid can build up in your lungs, making it hard to breathe. It's like trying to run with a weight on your chest, except you're not even running. This can be an early sign of heart failure or a symptom of a heart attack. 3. Palpitations. This is when you feel your heart racing, skipping beats, or fluttering in your chest. It can come out of nowhere and feel scary. It could mean your heart's rhythm is out of sync, something called an arrhythmia. This can affect how well your heart pumps blood. Palpitations might not always mean something serious, but if it happens a lot or comes with other symptoms, it's worth checking out. They are often linked to underlying conditions like atrial fibrillation or valve problems. 4. Swelling, edema. Have you noticed your feet, ankles, legs, or even your belly looking swollen or feeling heavy? Like your shoes feel tight or your socks leave deep marks? That's swelling, and it happens when your heart isn't pumping well enough to move fluid out of your body. Instead, the fluid hangs around, causing the swelling. This swelling isn't just from walking too much or eating salty food. It's often linked to heart failure. 5. Dizziness or fainting. Feeling lightheaded or like you're about to pass out isn't something to ignore. If your heart can't pump enough blood to your brain, you'll feel woozy, or worse, you might actually faint. It could be caused by irregular heartbeats or low blood pressure. It's a red flag for a serious heart problem and shouldn't be ignored. In severe cases, fainting may signal a significant obstruction or cardiac arrest. 6. Pain in other areas. Heart problems don't always come with chest pain. Sometimes it shows up in your arms, back, neck, jaw, or even your stomach. Here's why. Your nerves in these areas are all connected, so when your heart is in trouble, the pain can travel to other spots. Women especially often feel this during a heart attack and might mistake it for something else, like a pulled muscle or indigestion. 7. Fatigue. We all get tired, right? But this is different. This kind of tiredness hits you like a brick wall and doesn't go away no matter how much you rest. Why? If your heart isn't working efficiently, your body doesn't get enough blood and oxygen, leaving you feeling completely drained, even after doing nothing. This is often seen in conditions like heart failure, coronary artery disease, and even during a heart attack. 8. Cold sweats. Imagine suddenly breaking into a cold, clammy sweat out of nowhere, like you're nervous, but for no reason. This can happen if your heart is under serious stress or struggling to pump properly. It's often paired with other symptoms, like chest pain, and is a classic sign of a heart attack. If you've made it this far, don't forget to like, share this video with someone who could benefit from it, and subscribe now to unlock weekly tips that'll change your health journey. 9. Persistent cough. A cough that just won't quit, especially one that brings up white or pink mucus, can be a sign of fluid in your lungs, a condition called pulmonary edema. This happens when your heart can't keep up, and instead of pumping blood, fluid backs up into your lungs. The pinkish color suggests blood is mixing with the fluid, a serious sign and a common symptom of advanced heart failure. If you're experiencing this, it's time to talk to a doctor. 10. Bluish skin or lips. Cyanosis, a bluish tint to the skin or lips, indicates low oxygen levels in the blood. This can result from poor heart function, leading to inadequate oxygen delivery to tissues. It often appears in severe heart or lung conditions, such as congenital heart defects or advanced heart failure. This is serious and needs immediate attention.